All right, hello everyone. My name is Anastasia Georgievskaya, and I'm the CEO and co-founder of Haut. Haut.AI is an AI intelligence company that makes skin measurable at scale, and we utilize artificial intelligence methods and computer vision to derive multiple skin, hair, and face biomarkers and quantify our skin digitally. Haut.AI works with skincare companies globally, and we attending multiple events, and every day we see something new happening at the space of beauty, dermatology, and artificial intelligence. And they thought that we have internal discussions about these topics every day. And we really think that we can unpack them with you today. And that's why we decided to launch this podcast. And today I am joined by my great colleague, Dr. Monisha Madhumita, a board certified dermatologist. And she has extensive experience in artificial intelligence dermatology. She holds her own practice and she's very experienced in the skin of color. And I just amazed by how deep Manisha's knowledge is in this space. So today she will be joining for the podcast. Manisha, hello, and thank you so much for joining me today.
Thank you so much for having me, Anastasia, and very excited to be a part of How's first podcast. So, hi everybody, my name is Monisha Madhumita, and as Anastasia mentioned, I am a board certified dermatologist in India. I have my own practice and I work at the intersection of dermatology, aesthetics, and AI. I am what you would call perhaps skincare cynic or critic, where I'm very keen on ensuring that skincare is not just something we take very lightly. We move from observable claims to something that's evidence backed and trustworthy. And in that sense, I'm incredibly honored to be a part of how that's really pushing forward the conversation to make skincare objective and measurable at scale. So very excited to be here, and thanks for the opportunity.
It's our pleasure. Today we have extremely exciting topic, and I think I hear about this thing every 3 days at least. Or if I go to a shop and I will look at their counter, right, what is displayed, I will see many products with that, and we decided to say, okay, is it a real thing and does it work? And today our podcast is about exosomes. So
Yes.
yes, exosomes, yay. So, Manisha, tell me, as if I were a 5-year-old, what are exosomes?
Thank you, Anastasia. This is an excellent and timely topic. So, exosomes is something, unless you're living under a rock, it's impossible for you to have not come across what exosomes are. So, to put it simply, cut all the marketing and jargon aside, you can think of exosomes as these tiny messaging packages or tiny messaging packets that cells are using to communicate with each other. Just like how we text, just like how, several years ago we'd send letters. Think of these as letters or messages that cells are sending to each other to communicate. So within that is packed certain information molecules that can move and tell the cell how to behave. So what we're trying to do is through these messages, we're trying to indicate to the cell to repair better, to heal better, to produce more collagen, and to just grow stronger. So it's more than a skin treatment that changes the way your skin is. It's guiding the skin towards healing. Does that make sense?
That does make sense. I almost think like when I was a child, right? We like have the small plastic balls and we will like put the secret messages and then exchange the information,
Yeah.
right? So it's like the analogy of exosomes. And where do we actually get these exosomes? Where do we come from?
Your analogy of these secret messages is actually quite right, because when we really think about the source, the way it's carried forward, it can be really heterogeneous, and sometimes it can even be secretive, unfortunately, right? Because the sources can be heterogeneous. You can have them derived from human sources, animal sources, plant sources. They can be derived from fat tissue, plants of various kinds, and that will very critically affect the way these exosomes function and how suitable they are. And therefore, when we talk about exosomes, it really, sometimes irks me that it's used as a single label when a human derived exosome has drastically different functions as compared to something that's derived from fat tissue or from placenta or from, say, plants.
I couldn't agree more. And for our listeners, I also want to add that exosomes actually quite often look like small lipid balls. So they have like this lipid membrane, and they sometimes also called vesicles. So it's a synonym word to exosomes. And this type of vesicles are in our cells. and they have a lot of their jobs, right? They also carry the messages, or they carry different molecules. So imagine now what we can have as exosomes go outside of our cells and carrying the messages. And I just want to emphasize it's quite native to our biology to have these exosomes. And in my opinion, maybe that's why they are becoming so popular right now. But Manisha, tell me, what do you think? Why exosomes became so popular? One of the most spoken phenomena in the skincare world.
Yeah, thank you. I mean, that's a question I keep asking myself every single day too. There's a
I
saying in
know.
India, right? Yeah. So there's a saying that we have growing up that a whisper in one corner of the village, by the end of the evening, it becomes a talk in the whole town. And I think the origin story of exosomes is a little bit like that. There was initial evidence, preclinical studies, a few clinical studies here and there to support that it could have a role. But because it sounds so futuristic and, within the skincare world, we're just waiting for the next new thing, that it blew up. And it grew at a pace that outmatched the evidence that's backing it. In fact, the other day in my clinic, I had two or three patients coming to me with vastly different concerns. One of them wanted, their pigmentation to become better. The other wanted their texture to improve, and another wanted, improved hair density. And all of them came to me and they said, "You know what, doctor? I have exosomes all over my feet. I feel like this is it. This is the one solution to all of my skin and hair problems. Just give it to me and give me the highest doses possible," and that sort of thing. And there is a little bit of an exosome hysteria, if you can call it that, right, where they think it's going to solve all their problems. And I had to really sit them down and tell them, you know what, the evidence just doesn't match it. And if I'm going to practice dermatology ethically, we need to acknowledge that. So coming to, answering your question, I think this is a case of the story superseding and exceeding the actual evidence, because evidence, frankly, is not a very sexy term, right? It's slow, it accrues over time. But the story was just, too fascinating for us not to get a hold of. And that's probably why we see exosomes everywhere. But that being said, I need to acknowledge that peer reviewed literature, research, and studies right now do emphasize, even though they're optimistic, that evidence is still growing and we need to approach it with caution. In fact, at this moment, if I may, I'd like to mention an important study that's ongoing called the EXOCOMPARE. This was funded by IMCAS Fund. It's a non-commercial project where they would be assessing, I think, 25 to 27 commercially available exosome products to assess the real efficacy and whether it matches the claims they're providing. So it would be incredibly important to stay updated about the results and the ongoing evidence.
Okay, all right. Well, I'm quite excited that we're like having more evidence, especially for the new treatments, where I think we will be able to distinguish what's hype and what's like the real deal. But like talking more about exosomes, so we know several things about them right now. After the podcast, I hope our listeners will also carry it away with them. So we know what exosomes are. They're small lipid vesicles. We know where they come from plant or animal or human sources. We also know that they're very popular. We know that patients actually actively seeking exosomes. And now I want to ask another question. Do we know how exosomes work?
There's a long answer to that and a short answer to that. So the
Okay,
short
give me both.
answer is that both. Okay. So the short answer is not completely. We do have good, solid initial evidence that they do play a role in regeneration. So they do interact with crucial cells in in the skin, such as the keratinocytes, which is the most number of cells in the skin, the fibroblast, which gives the dermis its volume, with the melanocytes, the cells that give us pigment. So they are interacting and communicating with all of these cells. But to what extent and what is the kind of communication that's ongoing, that's a little unclear. So what does that mean for us? For us, it means that we can expect modest improvements in the aesthetic parameters that are commonly evaluated.
Only
I
modest.
mean, skin texture, yeah, modest. So,
Okay,
in fact, Anastasia,
I will take it.
a recent systematic review, it was published in the Aesthetic Surgery Journal, looked into its use for aesthetic concerns like skin texture, pigmentation, fine lines, and hair density. And roughly the improvement was about 15 to 25%, right?
Which is not bad. That's better than I will take it over no effect whatsoever.
Absolutely, but maybe it's not the holy grail we make it out to be. But what would be interesting is if we could combine that, as part of an integrated treatment plan. So if I have lasers planned or microneedling planned, along with exosomes, we're seeing very encouraging results. So as a standalone, it's modest at best. But together with an integrated treatment plan, an integrated skincare regimen, it would have greater effects.
Okay. Well, that's quite interesting. I think it also very well links to the trend of very extensive skin preparation and post procedure care, which we recently were also covering in our LinkedIn post with about the prejuvenation. So, is it fair to say that exosomes are also a quite a good candidate for this prejuvenation and post procedure care?
Absolutely, and your post was very timely in that sense because it's important for us to prepare the skin, and that's so important in skin of color because melanocytes are so reactive. We need to prepare the skin and get it prepared and ready for whatever procedure we have in mind, lasers or microneedling. So, in that sense, we're always looking out for new molecules that can modulate the inflammation, can strengthen the barrier, and make sure that you reach the results that we're planning. It's sort of like an athlete who is preparing for, a big marathon or a big race. We sort of prepare, with multiple steps. So, giving that analogy, right? So, exosomes are fantastic, but they're like an energy drink, right? It's also
Hmm.
important for us to remember the basics. So, SPF and good barrier repair, right? Those are things that are non negotiable. So, while I do think that there's great potential, especially for plant derived exosomes because of their robust antioxidant and anti inflammatory activity, it's important that we don't overemphasize the role of exosomes and then forget our trusted, reliable companions, SPF and a good barrier repair moisturizer. I think they play a far more crucial role, but exosomes could play a role in rejuvenation, pre, post, and peri-procedural care in a supportive sense, but they do not replace the role of the sheet anchors, SPF, and barrier repair formulations.
Well, I couldn't agree more with you. I think it's like in everything. You can't start playing basketball before you know how to lace your sneakers, right? So,
Exactly, exactly.
cleaning, vitamin C, SPF, barrier care before, any type of fancy stuff. We're always looking for miracles. Let's start with the basic.
Yes,
Okay,
yes,
Manisha,
exactly.
I'd like to wrap up the session, but before I let you go, I'd like to ask you a fire chat, three questions. Okay,
Of course, let's go.
so exosomes. Is there any exosome that you would recommend?
So, personally, for two purposes, right? If I want deeper regeneration, deeper healing, I would prefer human derived exosomes. But if my target is antioxidation, anti inflammatory effect, then plant derived exosomes that are treated in office would play a better role.
Okay, perfect. Then exosomes in office or at home use.
So this may be a little controversial, but I'm going to be real. When we talk about exosomes, we know the effect is modest even in office. So even if I have microneedling or lasers to enable the delivery, the effect is modest. So which means that I'm sorry to say, but the exosomes that you have in bottles or labeled serums and so on may have a very, very minimal to no effect. So if you're planning to have exosomes incorporated within your skincare regimen, please approach your esthetician or dermatologist so that they can deliver it better to your skin.
Okay, what's an adequate price of exosome treatment?
Okay, that's going to be a little challenging because I practice in India and we have, again, human derived exosomes, which we extract from the patient or client themselves versus a standard brand that would have like plant derived exosomes. So in India, this is the price that we have is somewhere between 200 to 300 USD, I would say, on conversion per sitting.
Wow,
So this is
wow, that's kind of expensive.
it is. So when you're approaching this, you need to be cautious about the kind of expectations you have because you're paying a significant amount. And which is what again irks me because we don't really have the evidence, but then you have clients and customers and patients paying this much, right? So are we doing right by them by just saying that it's going to solve all their problems? So, but if you're able to have exosomes delivered along with, say, microneedling or lasers or a better delivery, then I think it would be worth the price.
Fantastic. Manisha, thank you very much for coming together and joining me for this podcast.
Can I ask you something?
Of course, go for
Yes,
it.
yes, yes. So Anastasia's favorite exosomes or exosomes that you've tried.
Well, I will be honest, I actually have tried none. And exactly for that reason that I don't really know how they work and there is not enough evidence. So I'm actually like a conservative, cover the basics, right? I don't think in the last 3 years I, for example, ever missed a day of not removing my makeup, not cleaning my face, not applying a cream. So I kind of very conservative when it comes to the basics and like trying new stuff. So I'd like to see more evidence to come.
And it shows you're glowing, it
Thank you.
shows why basics always trump trends, right? Consistency beats intensity in skincare every single time.
Manisha, thank you very much for this compliment, but I also now pay a lot of attention to antioxidants to prevent the hyperpigmentation because it's also something I'm quite prone to. And I always listen to your advice, and like whenever your any post comes out or like you send me any article, I'm like reading it from like beginning to the end.
Thank you. Thank you. Fantastic.
Okay,
Fantastic. So we hope exosomes have been debunked.
I hope so
But
too.
we're waiting for evidence. We're waiting for evidence.
Yes, and for all listeners, if you have any questions, then please post under this video your question about exosomes or any other topics you would like us to uncover. And I'd like to wrap up and say, look, there is exciting new thing, which are exosomes, and we already have early evidence, even if it's moderate right now. But I'm sure it will be accumulating over time, and as with any
Yeah.
technology, it will probably become only better. So let's have our eyes peeled, let's stay alert, let's monitor the evidences, but let's also be open minded and make sure that we also discover all the science behind new things happening in the beauty. Thank you so much for joining us and tuning in, and we see you next time. Let us know what topics you'd like us to cover next.
Yes. See you next time, everybody. Thank you.